Forschung zu Geburtstraumata und psychischer Gesundheit rund um die Geburt ist wichtig, weil Gesundheit für mich mehr als die Abwesenheit von Krankheit ist. Viel zu oft erlebe ich, dass Geburtsreisen nach der körperlichen Verfassung von Mutter und Kind bewertet werden. Dabei wird vergessen, dass ein Gleichgewicht in der Ganzheit von Körper, Geist und Seele zur vollumfänglichen Gesundheit benötigt wird. Darum ist die Erforschung dieses Bereiches so wichtig. Vorhandenes Wissen kann integriert und ergänzt werden, um uns Einblicke und Visionen in den Wandel in der Geburtshilfe zu ermöglichen und ihn zu unterstützen.
Childbirth is more than just about survival of mother and infant. The mother and infant's well-being are also important. In fact, they're critical. Researching perinatal health and birth trauma gives women voices and helps improve systems and provides us evidence to provide women and families with better health care.
Und wenn man sich überlegt, wie selbstverständlich es ist, über Traumata zu forschen, nach Kriegseinsätzen, nach schweren Verkehrsunfällen, nach dem unerwarteten Tod von jungen Menschen und so weiter, dann ist es eigentlich eher eine Frage, warum nicht? Es scheint einem so selbstverständlich zu sein, dass man dann doch gerade über den Anfang des Lebens, über den Anfang einer jungen Familie sich ganz besonders behutsam Gedanken machen muss und Traumata, Gewalterfahrungen, Verstörungen, Belastungen, die mit einer solchen Geburt einhergehen, tatsächlich untersucht und fragt, wie ist es dazu gekommen, wie prägt das die Eltern, das Kind, wie prägt das auch eine Gesellschaft. Und das ist dringend notwendig, da vertieft und sorgfältig einzusteigen, um die langfristigen Wirkungen von so verstörenden Geburtserfahrungen und Geburtstraumata.
Research around perinatal health and birth trauma matters because the vicious circle of obstetric violence must be stopped. By putting all the weight on the women's shoulders and telling them that they should claim their rights during childbirth, we are not breaking the circle. Research needs to focus on the reasons that make health professionals continue the practices that we know are wrong. Research should also focus on the ways to help health professionals overcome these practices and train on new, healthier and evidence-based ways to treat women during childbirth.
Research on perinatal health and birth trauma matters so much to me because no one believes families what experience they had while giving birth to their babies. They tell us that we are too soft, but it isn't being too soft when you feel how they stitch you and the doctors don't believe your words. It is not being too soft when you're afraid of getting stitched again after 11 years. Your research, your hard facts, your statistics will help that they will listen to us.
Research on perinatal health and birth trauma matters because women on their own are just not believed. I've heard hundreds or maybe thousands of stories of women, how they were mistreated during childbirth or in pregnancy or in the postpartum period, and how they suffer from it, sometimes for a lifetime, but they're just not believed. But you researchers, you can collect the evidence and make it visible, and you can publish it in peer-reviewed papers. And maybe then women will be believed.
Research on perinatal health and birth trauma is important because women are suffering unnecessarily. Mothers are having difficulty bonding with their children, they're having relationship problems, and they're finding themselves unable to go back to work, all because they've been traumatized by birth. The Birth Trauma Association, a charity that supports women who've experienced traumatic birth, sees women all the time whose lives are made miserable by symptoms such as panic attacks, flashbacks, and anxiety. They tell us that good quality care would have made all the difference to their birth experience. We need research to show us how care during birth could be improved so that women and their families don't have to live with the aftermath of trauma.
Dear researchers, your research matters because families deserve to remember the birth of their babies with joy and not as a traumatic event. As a father, I was traumatized by the care we received, the lack of explanation, the coercion, not given a choice. For healthcare professionals, what they did was routine, but for us it was obstetric violence. Your research is a powerful tool that can be used to bring real change.
Research on perinatal health and birth trauma matters because the experience of pregnancy and childbirth can have an impact on the mother's mental health and her self-esteem. Unfortunately, a lot of women suffer from birth trauma, and often it's still not seen. Let us work on these issues. Let us work to provide the best care for mother babies and their families. Let us show to mothers that they are not alone.
Dear researchers, your research is important because millions of women are affected by birth trauma, yet healthcare professionals are mostly unaware of this. Your research can provide solid evidence that will help make this issue visible to medical community, to make visible how maternity systems are routinely traumatizing women. We need you to focus your efforts in informing practice, in developing protocols that will establish respectful and personalized care, will promote informed decision making, and will put barriers to the over-medicalization of birth. It is important that we change the culture in the birthing room in order to reduce traumatic births.
Γεια σας, είμαι η Ζηνοβία από την Ελλάδα. Θα ήθελα εσείς οι ερευνητές να λάβετε υπόψη σας υπό ποιες συνθήκες και ποια ενημέρωση για τις επιλογές τους και τα πιθανά αποτελέσματα αυτών δέχονται οι επίτοκες, ώστε να συνενούν ή όχι στις ιατρικές πράξεις που υποβάλλονται αυτές και τα μωρά τους. Η έρευνά σας για τον τραυματικό τοκετό είναι σημαντική γιατί η ποιότητα των υπηρεσιών στη γέννηση αξιολογεί την ίδια την κοινωνία. Πώς δηλαδή εκείνη φροντίζει και δέχεται τα νέα μέλη της που θα γαλουχηθούν από μάνες τραυματισμένες.